Keith, we're going to go to the issue of aged care. We know it's in crisis. You said prior to the election, if Labor push on with this idea that every nursing home's got to have 24/7 nurses, lovely aspiration, but how are people going to pay for it? Doesn't it have to be staged and come in a more sensible way? You said it would cause homes to close. We find out today 47 homes have closed their doors since September, since those reforms came through last year. This is the problem. Too much, too fast.
Peter, sometimes I wish I was wrong, but I'm not on this. I've got a local aged care facility that will be closed by Christmas. That will be 50 beds roughly and 50 staff gone. There's been over 800 beds lost in the last 4 months, according to reports. And we said this would happen. We said it would impact regional Australia even more than in the cities because you just can't get what they're demanding. Tens of thousands of nurses short. What would you rather have? No beds or beds that are at least monitored, managed and looked after as they have been for some years? But this is Labor ideology 101. They don't care about the ability for people to deliver. They don't care about what it costs and they don't care about the impact, particularly on regional communities. And these are our people, Peter. I mean, they don't want to shift to a capital city just to get an aged care facility. No. They had perfectly good ones in regional Australia and they are closing by many numbers. Lots of them are closing.
Hey, Daniel, I always say the devil's in the detail, particularly in Victorian government terms. Those sobering up centres, once they got rid of public drunkenness as a crime in Victoria, they've got these centres, 10 of them coming to put people in when they're drunk. We find out today that 9 of the 10 will be for Aboriginal Victorians only.
Well, Victorians just voted against this with the voice very strongly against this racially divisive policy, as we were just discussing. I think it's deeply concerning and also offensive to many Victorians and Australians that you would have race ahead of need in terms of access to potentially critical social services and medical support. If you have a non-Indigenous Australian next to an Indigenous Australian, well, they should both have the same right to access that service. It's not at all clear why the government is going down this road to prioritise Indigenous people over everybody else. And like I say, it cuts across absolutely everything that our society should be about, which is about equality before the law and equal access to services. And I think the community is going to be deeply concerned when they learn more about this massive policy failure, yet again, coming out of this government.